This is a presentation on best practice for CLABSI prevention with a demonstration on central line changes for your UVC. Emily is now demonstrating proper hand hygiene by washing for a full 2 minutes, causing friction and cleansing all parts of her hands. Please note, per policy, Emily is bare below the elbows, not wearing a watch or rings. Emily has gathered her supplies, verified her orders, and for TPN has also verified the weight. The supplies gathered are for a maintenance 24-hour IV change for TPN and lipids and a medication line. Emily is prepping her workspace, cleansing it with the gray top wipes. This will include all high-touch areas: countertop, bedside cart, and giraffe. Once cleaning is complete, Emily would change out her gloves, place a mask on, and begin to prepare her IV supplies. Among the supplies are sterile towel. This towel is only used for barrier from the surface areas. All of the IV tubing has a sterile pathway, so it is key to maintain that sterility by not touching any of the exposed ports. In the NICU, we use the IV tubing with the Buretrol. The Buretrol creates another safety feature to minimize excess fluid getting to the patients in the event of an IV pump malfunction. Emily is laying out her IV tubing with a burette, a 3A extension tubing, Medline tubing, microclaves, and has her swab caps to the side. Best practice to connect each IV tubing, extension sets, and microclaves one at a time. When opening the microclaves, leaving them in their open packages can create one more barrier to potential contamination of any items coming close to the open central line catheter. Central line associated bloodstream infections are most commonly contaminated by a breach in standard aseptic precautions when accessing the catheter. This includes IV fluid and tubing changes. Emily is now connecting her 3-way extension tubing to her maintenance IV fluid. In this case, it's TPN. Any maintenance fluid will need a filter attached. This is an example of our 3-way extension set. As supplies change, the item may look differently. Our lipids need a specialized tubing to protect it from light, as well as a specialized filter. Medication lines do not need a filter, as this will filter out your meds. Pay close attention as Emily is not touching any of the open ports. This is our microclave, which creates another barrier to decrease the risk of infection. It has a microbial barrier design, which minimizes the entry points for bacteria. For your IV medication tubing, you will have a microclave on either end. This is a high access area for medications, entries, and this will decrease the infection risk. As Emily has ran all of her IV fluid through her IV tubing, she will wait her second nurse to help her with changing out her IV tubing closest to the catheter. Serena will act as the second nurse, assisting Emily in changing her IV fluid tubing aseptically. She will scrub her hands for a full 2 minutes, has no watch or rings on, applies a mask and gloves. Serena will turn on the air curtain feature on the giraffe to keep the heat inside of the bed. She has collected her clean alcohol pads and will place them at the head of the bed. This is deemed a clean area in your giraffe. Before accessing the microclave, she will scrub the port for 15 seconds. Emily, the first nurse, will attach the clean IV tubing. The second microclave on the stopcock will have a swab cap added. The swab cap has a microbial solution inside. Once it is attached, it starts disinfecting within the first 30 seconds. The microclave will be scrubbed for 15 seconds. The swab cap will be added. Swab caps can be changed out every 96 hours with the microclaves. This is a dual lumen UVC. The second lumen is going to be used for your medication line. Again, make sure the IV fluid has been turned off to the baby. You will be scrubbing your microclave before accessing it. The first nurse will attach your med line to your microclave. And we add another swab cap to the microclave on the other port of the stopcock. Anytime you have a double lumen UVC, the primary lumen will be used for your maintenance fluid. The second lumen is typically used for IV medications or IV drips. Once your IV pumps are correctly running, everything is verified, you may turn on the IV fluid back to the baby. This is a demonstration of the PICC line. Our PICC lines will have a T connector attached. This is part of the setup and does not get changed out. You can add a swab cap to the microclave on the T connector that's closest to the baby. This is the setup. PICC line down to T connector has a microclave, and then your IV fluid would be attached.